Good afternoon, everybody. Thanks for joining us here today for our monthly update on overdose deaths and some of the actions we in San Francisco are taking to combat the behavioral health, drug, and homelessness crisis. So let me jump straight to it. First, for the overdose deaths for this month, I just want to thank the Office of the Chief Medical Examiner, as always, for providing this information, which is incredibly helpful to us. The overdose numbers for August were 48. 48 overdose deaths for August. That compares to 53 last month in July, 44 in June. Compared to last year, the same month, we were at 47. Year to date, last year at the same time, we had 466 overdose deaths as of this time period. This year, for the same period, we are at 460. And this is so 6 fewer same period last year. And it is the second time this year that we've been able to dip into the 40s. And so that in my mind is positive, but I want to be clear, we are not at all satisfied by that. There continue to be far too many overdose deaths in the city and county of San Francisco. You hear me say this every single time I come up here. Every one of those deaths are preventable and unacceptable. Part of what we're going to talk about today for how we're combating this is our ability to quickly get people treatment and access to life-saving medications to combat their opioid use at really almost any hour of the day. And we spend a lot of time at the department, DPH, and in the city trying to engage folks. We certainly have shifted to a more proactive approach to help people get on a journey of treatment and recovery. And we often engage with folks at all hours of the day who are actually ready and willing for treatment. One of the challenges we still have is that when someone is ready for some sort of treatment, it sometimes takes too long to get them there. And when it takes too long or it's too difficult, we lose that moment. And that is something that we don't want to have happen. So what you'll hear from Dr. Hillary Cunnins, who's our Director of Behavioral Health here, as well as Dr. Noel Martinez, are things that we're doing to make sure that folks, when they raise their hand into the wee hours of the night for access to medication, buprenorphine, Suboxone for their fentanyl or opioid use, that we can teleprescribe and get them that prescription kind of in that moment without sending them to a clinic for an appointment sometime the next morning or to have to take Muni to some other place. We have to be able to meet folks where they are, and that's really what this program, we call it BEAM, does. So with that, I'm going to turn it to Dr. Hillary Cunnins to talk about some pretty darn exciting things we have here in San Francisco that I think are nationally leading and being able to meet people where they are at in the streets, including to the wee hours of night when they're ready for treatment, to quickly get them a prescription and initiated onto treatment. So with that, Dr. Cunnins.
Thanks, Director Sy, and good afternoon, everyone. My name is Dr. Hillary Cunnins. I'm the Director of Behavioral Health, and I'm joined by Dr. Noel Martinez, Medical Director of our BEAM program. 1 year ago, San Francisco Department of Public Health began to offer on-demand telehealth so that anyone in San Francisco who has an opioid use disorder could call public health between 8 a.m. and midnight to talk to an addiction medicine specialist. The program is now available 8 a.m. to 2 a.m. 7 days per week. By calling our helpline, individuals can obtain a same-day prescription for buprenorphine, or they can get a handoff navigation into methadone treatment. Buprenorphine and methadone, as we have described, are the two most effective treatments, reducing the risk of dying of overdose in people with opioid addiction by 50%. This telehealth program is the only program outside of the emergency department where people can access treatment 18 hours a day, 7 days a week. We piloted this on-demand telehealth for 6 months with clients who were being engaged at night by our street health workers, code Tenderloin, in the Tenderloin. We found that there is a high demand for treatment at night, specifically when there are few, if any, clinical settings open for people interested in starting a journey of recovery in the moment. Over the past 18 months, the results have been promising and shown that we can offer treatment, engage people in treatment, and get people into care when they want it. We have grown the service and adapted the service to meet their needs. Our street health workers continue to be the main source of referrals to the on demand telehealth line, but other people are also seeking help. We are receiving calls from people in shelters, supportive housing sites, private residences, and through referrals from our network of community based organizations. Month over month, we have seen the number of clients we are reaching continue to increase. We served approximately 225 unique clients in August of 2024, and more than twice that, 460, in July of this year. In total, since we first piloted this service in March of 2024 and through August of 2025, we have served about 3,400 unique clients, and about half of them have gone on to start a medication for opioid use disorder. That means that those people who receive medicine are at decreased risk of dying of overdose and starting their path to recovery. We also, as we've discussed or described with you, since May, 82 patients have elected to start long-acting injectable buprenorphine. That is a form of the medication that is injected and lasts for a month, requiring people to not have to take a daily medicine and continues their protection over the month-long period. when we first launched, just a handful of patients returned to receive their second shot of buprenorphine. Because of our use of injectable medication and because of our use of patient navigators and counselors, we have seen an increase of people staying in treatment for at least a month, and we are working to grow that number more and more. Our clients also have options as to where they can receive treatment, and that includes street-based settings, walking into our behavioral health services pharmacy at 1380 Howard, and other places. Recently, we launched street outreach workers teams in the Bayview neighborhood, aiming to reach people who have an opioid use disorder or addiction and help them start treatment. In the Bayview during the day, we have focused our outreach to older Black African American men who we know are at disproportionate risk of overdose in San Francisco, dying at a rate of 5 or 6 times higher than others in San Francisco. This fall, we will be adding another team of nighttime outreach workers to focus their efforts in the Mission District. As you can see, we are intent on increasing our reach and intent on increasing the number of people we pull into care and support to start their journey of recovery. We are aiming to meet people where they're at, regardless of the time, and make it as easy as possible to begin to recover. Thank you.
So now we'll take a few questions if there are.
Yeah, can you provide an update on the department's goal of adding 140 more new treatment beds to the existing system, and whether or not the sober beds, such as Hope House, are counted as part of that goal?
So I can't remember the exact numbers of every piece, but yes, we all the new beds we talked about, we are on track for. In fact, for including for the recovery oriented kind of drug free sites. So the Eleanor Fagan site on Mission Street has opened within the past few weeks and is on track for is already receiving folks. Just this week, the our site residential step down at the Marina Inn is starting to accept clients as well. Again, that's for folks, drug-free environment for folks that have graduated from residential treatment and need a stable place to be, continue to be drug-free, build on the gains, work, life coaching, financial coaching, continued engagement in clinical services. That has opened up, and Hope House has opened as well. We have previously provided a breakout, and we can follow up again with each of those sites. All of those have opened and are on track as we had planned and budgeted for. And we think that'll be really important, needed capacity. So our goal is we quickly meet people where they are at with things like teleprescribing of buprenorphine at midnight. And also, we want to make sure there's also there are places for folks to go in their treatment and recovery journey. And the new beds that are coming online, we think are going to help that substantially.
Any other questions?
Any funding or budgetary concerns looking ahead to 2026 after the big beautiful bill, or is that too soon to call, not part of your thing?
Well, I mean, we in the city and in the department, we've been on the record noting that we think the bill that was just passed by Congress and signed by the president will have incredibly challenging impacts for San Francisco. Not only will many people lose their healthcare coverage through Medicaid, as many of us kind of said very much so when the bill was being debated, but we here in San Francisco stand to lose a substantial amount of federal revenue for Medicaid, which as the state safety net provider is going to be incredibly challenging on top of budget challenges already in the city. We at DPH across the city, with our other partners, are going to figure out how we continue providing care, which is our job and our mission. And it's going to be very difficult from a budget standpoint, given the immense federal cuts that we anticipate. Thank you.
One more.
Assuming that Newsom is going to sign 8260, can you kind of clarify how that will be implemented among DPH providers?
I think we can follow up on that. Thank you. Okay, take care. Thank you all.